Ms. Capps.
Thank you, Mr. Chairman. I first want to thank and commend you, Chairman Waxman, Chairman Pallone, Chairman Emeritus Dingell, for your work on this legislation. I thank all those of you, members and staff, and others for whom this issue has been your life's work. I particularly want to thank you, Mr. Chairman, for your openness during this process. We have had a thoroughly extensive, perhaps even exhausting number of hearings on the topic and on the legislation. And you've been very willing to listen to our concerns and to take into account our priorities as this bill was being written. I was proud yesterday to stand with the President at the White House as he highlighted the nursing community's support of our efforts and listened as he stressed again the urgency of passing health reform this year. In fact, one of the elements of this bill, of which I am proudest, is the inclusion of the excellent investments in our nursing workforce, coupled with greater access for patients to nurse-provided services. But that's only one piece of a comprehensive strategy, which will finally take us from a system that focuses on illness-based disease treatment to one that focuses on wellness-based health care. Now, my colleagues have heard me many times, as I did yesterday, address my disappointment in CBO's failure to score comprehensive prevention strategies as a cost savings. But I am still confident the steps we are taking to provide greater access to primary and preventive care and to encourage community-based wellness activities will produce positive outcomes, not only financially, but also morally. And that gets at the heart of what this bill and this healthcare reform movement is all about. A moral obligation to ensure that all Americans have access to quality health care, not just the lucky few. To ensure that every child born is guaranteed access to checkups and vaccines, just like the kid sitting next to him or her in the classroom. To ensure someone with a chronic disease like epilepsy or diabetes doesn't get excluded from purchasing health insurance. To ensure that the loss of a job or a career change or tragic accident or an unexpected illness doesn't mean that you're now then going to do without health care coverage. And to ensure that no one has to decide to forego a meal in order to pay for medication. I'm fortunate to have spent most of my life working as a nurse. Nurses are known as the most trusted of all professions. Fortunately, I fear I gave up this title as I became a politician. So simply put, I urge my colleagues, as the American people do, to trust nurses again when we nurses urge you to support this bill's approach to health reform. Thank you, and I yield back.
Thank you very much, Ms. Capps.